So welcome back and well done for staying the course of 3 lectures on thyroid disease for third year medical students. We're now at the end of this course and we're going to look at the extension questions ready for the session we have together at the end of March. So please make sure you've reviewed the 3 online lectures. I've already given you some links to other materials that you can use for your extension learning. And then have a go at these extension questions. Bring your responses along with you and we'll have some fun during our time together. Here we go. First one. You learned that thyroid hormones are mainly bound to plasma proteins. I want you to find a specific example of a prescription drug in current use that causes clinically relevant disturbances in thyroid hormone homeostasis. Number 2. I think the history of thyroid function testing is absolutely fascinating. So 2 examples for you to research. Believe it or not, the ancient Egyptians invented the first test of early pregnancy. So I want you to find out, how does the thyroid figure in this? And secondly, in the 1960s, what sort of tests did we apply to thyroid function? Question 3. A patient who is moderately clinically thyrotoxic. Here are his thyroid hormone levels. But something doesn't fit, and I want you to tell me what that is, and then tell me how you will investigate this. Graves' disease we talked a lot about as a classic autoimmune condition. I'd like you to prepare a working definition, and I'd like somebody to have a go at a form of words that you would use if you were explaining this to a patient, for example, in outpatients. Finally, you have OSCEs, I believe. Correct? You're asked to examine a patient to determine their thyroid status. What is meant by the term thyroid status? And then I will ask a suitable person to select one of their friends and to take us through their approach to clinical examination to ascertain thyroid status. So thank you so much for your time on this lecture course. I hope you've enjoyed it and I hope you found it more interesting than your average lecture. If you're interested in doing a lot more besides flipping the classroom, there's this amazing link that gives you lots of tools about collaborating, making presentations, sharing, working on projects, more resources than you can shake a stick at. So this is Dr. Pete Davis signing off on this lecture series on the thyroid for third year medical students.